In this video, I'll discuss the symptoms, diagnosis, and treatment of glaucoma. In short, glaucoma is a disease that damages your eye's optic nerve. Your ciliary body constantly makes aqueous humor, which flows from the posterior chamber through the pupil into the anterior chamber. This liquid nourishes the eye and keeps it inflated. As new aqueous flows into your eye, the same amount should drain out. This process stabilizes the pressure of the eye, called intraocular pressure. However, if the drainage angle is not working properly, fluid builds up, and the pressure inside the eye increases, which may damage the optic nerve. If we take a closer look, we will see that the fluid drains through an area called the drainage angle, which refers to the angle formed by the junction of the iris and cornea. Over 90% of the aqueous humor exits the eye via the trabecular meshwork and the Schlemm canal, and 10% via the ciliary muscle, called the uveoscleral outflow. There are two main types of glaucoma, named after how the liquid outflow is blocked. The first type is open-angle glaucoma. In this case, the drainage angle in the eye is open but not working efficiently, causing gradual increase of intraocular pressure. As the nerve fibers at the back of the eye die, you will develop blind spots in your peripheral vision. You may not notice these blind spots until most of your optic nerve fibers have died, which is why an open-angle glaucoma often has no early symptoms. Closed-angle glaucoma, on the other hand, is far more severe and acute. In this case, the drainage angle in the eye becomes blocked, preventing the aqueous humor fluid from properly draining out of the eye. This blockage causes a sudden increase in intraocular pressure, leading to symptoms such as severe eye pain, headache, nausea, vomiting, and blurred vision. Patients may have a history of similar attacks that were alleviated by sleeping. This is because, during sleep, the pupil constricts, potentially relieving the blockage by removing the peripheral iris from the drainage angle. Another common symptom is seeing halos, which is especially noticeable at night. Normally, the cornea remains transparent due to the continuous removal of fluid. However, when pressure rises rapidly, the cornea becomes waterlogged, resulting in the perception of halos. Closed-angle glaucoma is considered a medical emergency and requires immediate medical attention to prevent permanent vision damage. When a patient presents with glaucoma, their eye will appear normal on superficial examination. Therefore, the best diagnostic signs are changes in the optic disc. The optic disc is a small, circular area in the back of the eye, where the optic nerve connects to the retina. The cup-to-disc ratio increases as the nerve fibers atrophy. The normal cup-to-disc ratio, the diameter of the cup divided by the diameter of the whole nerve head or disc, is about 1/3, or 0.3. Visual field loss is challenging to pick up clinically, as it often becomes noticeable only when there's a 50% or more loss of nerve fibers. Intraocular pressure measurement is also commonly performed, with normal values typically falling between 10 to 21 millimeters Hg. However, elevated IOP is no longer considered a definitive diagnostic biomarker, as glaucoma can occur in patients with IOP within the normal range. Typically, pressures ranging from 20 to 30 milligrams Hg tend to cause damage over several years, while pressures in the range of 40 to 50 millimeters Hg can lead to rapid visual loss. The treatment approach for open-angle glaucoma primarily focuses on reducing intraocular pressure. This can be accomplished by using eye drops, which function by either decreasing the production or increasing the outflow of aqueous humor. Beta blockers, for example, block sympathetic nerve endings in the ciliary epithelium, thereby reducing aqueous humor production. Similarly, carbonic anhydrase inhibitors decrease aqueous humor production by inhibiting the production of bicarbonate ions, which are crucial for its formation. On the contrary, prostaglandin analogs enhance outflow by stimulating uveoscleral outflow. An interesting but unintended effect is the promotion of longer, darker upper eyelashes, which is why prostaglandin analogs have been remarketed as eyelash growth serums. Additionally, alpha-sympathomimetics serve to both decrease production and increase outflow. An alternative to eye drops is laser therapy. Laser therapy aims to achieve one of three objectives: opening the drainage tubes, destroying some tissue responsible for producing aqueous humor, or creating backup ports for fluid drainage by making a hole in the iris. For acute closed-angle glaucoma, treatment typically involves administering 400 milligrams of Diamox and instilling pilocarpine into the eye every 15 minutes to induce pupil constriction. Analgesics and antiemetics may also be provided if necessary. Ultimately, the definitive treatment is iridotomy, which is performed once the inflammation has subsided. As a precautionary measure, the same procedure is typically performed on the other eye as well.